Thank you for the opportunity to tell a little bit what we are going to do this year in the World Health Organization in Uzbekistan. What we're doing in 2014 is framed within our bilateral collaborative agreement with the government of Uzbekistan and the Ministry of Health for this year and next year. And this again is very much framed now by the new European Health Policy Health 2020. The European Health Policy Health 2020 promotes population health and reducing health inequalities and addressing population health through a whole society and whole of government approach. The document has been developed in a very consultative manner and is based on best international and national evidences. It basically suggests 4 priority actions for policymakers to invest in the health sector through a life course approach and through empowering people to tackle the regions and the countries' most prominent health challenges, to strengthen people-centered health systems and to create resilient communities and supportive environments. Now, the way we try to implement that in country is basically through the 5 WHO priority programmatic areas or categories. Number 1, the non-communicable diseases that would very much focus on heart disease, on lung disease, on cancers, but also on risk factors such as tobacco and alcohol control, mental health, violence and injury prevention and nutrition. Then the so-called communicable diseases, HIV, TB and vaccine preventable diseases. The third area would be promoting health through a life course approach which focuses on maternal and child health but also on the broader issues of reproductive health. The so-called social determinants of health, which may be lying in other areas and other sectors such as gender, such as poverty or the environment. Overall climate change and health would be an important part of that. The 4th category is to strengthen the health system itself. Here we're trying to strengthen and support the government in developing evidence-based national policy strategies and plans. Also, provide integrated people-centered services and to provide the best evidence and strengthen information systems. I also would like to mention the global WHO priority of strengthening universal health coverage in countries. Finally, the category 5, the preparedness, surveillance and response. That would include, for example, to strengthen alert and response capacities of government, help Uzbekistan to implement the international health regulations, to strengthen laboratories to prevent outbreaks, to ensure food safety and maintain the polio eradication. So those are the 5 technical areas in which we're going to continue to support the government. When it comes to this year, 2014, we will very much try to work within the Health 2020 policy approach by addressing inequities in the state of health of vulnerable population groups and supporting the formulation of related policies and strategies, but also by strengthening the health system through national councils, expert advisory groups, and expanding the role of the coordination for the health sector and overall the sector-wide coordination in the country. We will also continue to support the government in achieving its Millennium Development Goals, and that still means a strong focus on achieving Millennium Development Goals number 4 and 5 on women and children, but also number 6 on TB and HIV. We will intensify our support to the implementation of the new national strategy to combat non-communicable diseases, as mentioned before. We will also try to support this further strengthening of public health functions and capacity building through health promotion, informed policy making and resource allocation, which will go into the area of health financing, including with other ministries such as the Ministry of Finance. We will continue our advocacy through health-related events such as the World Health Day, the World TB Day, World HIV Day and other events. And finally, we will continue to encourage a whole of society approach, emphasizing the role of the civil society, of mass organizations, of the private sector, and the involvement of other sectors and decision makers for the benefit of the health of the people.